Good morning to you and welcome to our friends at Guam Regional Medical City. Time for your healthcare partners, brought to you by GRMC, where patients are partners. Let me introduce to you some of the cleanest people on the planet. This would be Amy. I'm going to call you Amy Egurrola.
Yes.
And Amy Egurrola, she's the Central Sterile Supply Department Manager, and Alcie Papa.
Yes,
Wow, what an easy one, who was a technician there. The Central Sterile Supply Department. Somebody's got to tell me what exactly that is. I feel suddenly so dirty next to you. You want to talk right into the microphone, just like how I'm doing? Yeah, if you don't mind, that would help us listen to you. Hi, Amy.
Hi.
It's nice to meet you.
It is nice to meet you.
I like that Charlie is bringing us members of the team that we may not otherwise see. But your presence there is crucial to the hospital.
Yes, it is, because we're the people that are behind the scene.
Mm-hmm.
They don't really see us most often, because as soon as we get to the hospital with our outside clothes, we change into the scrub.
Mm-hmm.
That means, we're entering the sterile area that we are going to work to.
Talk to me about that. What areas are sterile areas, and what does a sterile area mean?
Sterile area means are the sterile area where I belong, and the surgical unit. That's the operating room. That's extremely sterile too. So what they do there is almost similar when in terms of sterile places. Not anybody else could just go in there with their street clothes. They need to have a personal protective equipment to wear to go inside there. You cannot go in there with your civilian clothes, so you need to change into proper attire that's required.
The sterile area that you're talking about, like the surgical units where you have to contain, right?
For surgery, for people that are having surgery.
Right. It has to be okay. How easy is that to do, or tell me how difficult that is? What is your job, first of all? What's your job as a technician?
Basically, I'm the lead technician for the CSSD department, so I make sure I have trained all the younger technicians, all the standard. So basically, I train them from doing the decontamination, doing the assembly, and trying to service the operating room and even the emergency cart. So I train them from A to C. In behalf of Miss Amy, she advised me how to do it. But actually, before she advised it to me, we have a standard already on how to follow regarding
the procedure.
the procedure.
Are these federal guidelines?
There's a lot of governing bodies that needs to be followed, because it's instrumentation that's used for the patient as its own required process. It's not like during the traditional way, the olden days, you just put them together in the machine, at one time, and then when they come out, they're all sterile. Nowadays, on the new concept of sterilization process, which is governed by a lot of governing body like the Alcie and Amy that I was talking about, and the OSHA or FDA, it required a manufacturer's guideline on how to process its instrumentation for any particular surgery procedure.
So we're not putting everything in it like a blue water.
No.
No. What's the sterilization process? Is it a machine?
The sterilization process is terminating all the microorganisms. It's a machine. It's a sterilizer. It's a big, as big as the biggest refrigerator, so to speak, if you look at it.
Oh, really?
But, it's preset by the company that produced it, and there's a pre-market approval, for that
I see.
to be out in the market.
Is it hot water? Is it steam?
It's a steam, 270 degrees.
Oh my gosh!
So you can, cook a whole
Yeah.
cow in there, you know.
Well, hopefully not with the instruments,
Yeah,
but
no.
270 degrees, it's sterilized.
Fahrenheit.
And it is used, it's steam, and are there chemicals as well?
It is steam. It consists of steam and heat combination.
I see.
So it will process it when the steam is distributed
Mhm.
with a required temperature.
Right.
The sterility assurance level will start ticking until the cycle is complete.
It's kind of like putting something in a dishwasher, basically.
Yes, and then
Oh.
it's preset by the company.
So you
on-
can't change the level, or you can't change the heat or any of the other functions. It's
We can change
We can
it
change it.
because there is some specific items that we put there that is specified what load is it
so
going,
different.
what
So
cycle.
different instruments
Different
have
input.
different
Multiple-
heating temperatures.
Yeah,
I
multiple
see.
cycles that
Oh,
we put in
okay.
there.
Yeah.
So, like I said, you know, there's multiple cycle on different kinds of instrumentation.
Mm-hmm. Are you actually in these units, in the surgical unit, or are you the prep people? You go in before and after?
We are separated.
Separated,
You
yes.
know, the CSSD is separated, and it's divided into multiple
Areas.
parts,
Mhm.
areas.
Mm-hmm.
We have the decontamination area where we receive the used and bloody instrumentation after they use it in the operating room. Then we process it from there. That's where we do the sorting, the inspection, and the cleaning. Then we put it on the automated machine, you know, to disinfect. So when we put it there, it will come out to the opposite side of the place,
Mhm.
the CSSD. It will go out on the assembly area.
Assembly area.
So as soon as it's gonna come out there, somebody working in that part
That
of
area,
the
yeah.
CSSD will retrieve it. It's safe to the touch because it came from the cycle already.
But that person's also gloved, and they're also wearing sterile.
No.
No,
in-
no
in the
more.
sterile area,
When it
no.
come out to the clean area, after the cycle from the decontaminated area, it is already safe to the touch.
Correct.
That's where the assembly is.
checking,
And then, you know, we have microscopic
lens.
lens in there to check.
To check the levels of bacteria or anything
if
if
it's
there's.
clean
Ah.
before we even
So there
set
should
it
be
up.
no presence of anything on
Correct.
these instruments once they're done.
Yes.
They're completely sterile.
Yes.
Not
No,
yet.
it's not yet.
yet.
Oh,
They're
oh,
clean.
not yet.
clean.
There's
Not
more.
yet.
It's
Okay.
clean.
They're
It's
clean,
clean.
but they're not sterile.
I see.
So that's where we inspect them again.
Ah.
Magnifying glasses is
No kidding.
throughout. Yes, that's the process. Then if you see it, and indeed that there's no more protein materials or
And a bioburden.
bloody bioburden or anything, then you're ready to set it up in coordination with a quality assurance checklist. How many are supposed to be in a tray? What it is supposed to be in a tray?
Or what service.
And then what kind of service? Is it orthopedic, GYN,
Oh, I
urology?
see.
Then we set it up. There's a quality assurance checklist so that when we issue it, that goes with the instrumentation set, so we expect it to come back
Complete.
complete in coordination with that checklist.
Okay, the
checklist.
way it went in, it has to come back out the
Yes,
same way.
yes.
I see. Sean's got a question for you, if you don't mind answering. Sean, hi there.
Afternoon.
Hi.
Afternoon.
I got one, or rather two questions. One is, do you have a full-time technician that is certified to handle equipment? And two, if that equipment has been here and installed, is there a contract in place for the maintenance of the equipment for the lifespan of it?
Yes, sir, we do. We have the biomedical engineering department. So when we receive certain equipment, it has to be checked by our biomed engineering department before it goes
Service.
to my department to be processed, accompanied by the manufacturer's guideline, like I said, on how to process it to be ready for surgical use.
Okay, and then you have routine. He asks about maintenance. How's
Yes,
the,
that's
yeah.
the maintenance.
Oh, I
They
see.
have a preventive maintenance.
Okay.
As soon as it gets to us, it passed by the engineering department. There's already a scheduled preventive maintenance on what the manufacturers required.
Okay. The bottom line is that your job is to keep everything clean, basically.
Yes.
And there is a great responsibility to do that because of the dangers of having, contamination
Yes.
spread.
Yes, exactly, because one infection that it will be acquired in the hospital, it will cause a domino effect, to us. We will diminish our reimbursement only because of the kind of glitch that we may have, if there is, and then they can strip off our accreditation.
Yeah, yeah.
If we reach that level of infection that is getting.
What's the checks and balances? Is there a required number of people's eyes that are on inspecting these pieces of equipment before they're loaded into this other machine? You have.
Yes. I have 7 staff
Okay.
that do the job. So everybody else are on the same page, and we keep up to the standard at all time. There's no excuses why, we made that mistake. As far as I'm concerned, we need to be
There's no
really,
margin of error.
Yes. We're only human, but,
Sure.
there's an acceptance to that. But, if it's 2 mistakes in a quarter, then maybe
Yeah.
I may
You
put
have to
you
retrain the
someplace else
technician.
and
Yeah.
retrain you
Yeah.
because,
Now, I was going to ask you a question about, darn it, I was going to ask you a question about something specific. I'll skip to it. And I'm assuming then that your own environment in your house is pretty sterile?
It's pretty much.
I mean, now.
Sterile and organized.
And organized. I
Yeah.
mean, that's the key.
He
Are you?
went to visit my home already. It's a simple home,
Uh-huh.
but like what you said, it's a mimic of
Of your work.
where I work
Yeah.
because I practice it, so
Yeah. Yeah.
I
Every
do
day.
it.
Yeah.
and
How about your place?
Yes.
Are you pretty clean up over
I'm
in your own
kinda
house?
OCD
Are
already.
you? Did the
Sometimes,
job make you that way?
At first, yes. It helps me more be organized and more cleaner because basically my profession is like on computer engineering, but then I start loving CSSD as my profession. But yeah, it helps me being a better person, I could say.
Yeah, but are you a germaphobe? Like, are you afraid
No,
when
'cause
people
like-
come to shake your hand or
No,
kiss
no,
you
no,
on the
no, no,
cheek
no.
or any of that stuff?
No.
No, you're not that. It's
No,
not
no.
that bad. What about when you become sick? What if you have a cold or you come on? Is there a rule
There's
about
a rule.
what is the?
There's a rule. When we have that, you rest. You stay home until everything, gets well, because we don't like to have an airborne
Yeah.
microorganism flying around,
On the
because,
apartment.
we have the humidity and temperature, and then if you're sick, then, sneezing all over the place, of course, airborne pathogens are all over, microorganism, it
Of course.
can
Yeah.
get caught to anything that we distribute,
Sure.
so if you're sick, you stay home.
Yeah.
I will understand that.
Well, I like to know that the standard of cleanliness and sterility at the GRMC is at its highest. Are you monitored at within the year, or there's like by the quarter, or do they come and check on you?
The infection control practitioner, which is, I called her the microbe police,
Yes.
resurrection, she will come and inspect the place. Not only my place, she goes all over, quarterly schedule, unannounced. She'll just pop in.
Oh.
And she will check, are the door closed? Are the eye wash are covered? Because we need to test the eye wash every morning. So when we test them, we open the knobs, we test them for 10 to 15 minutes. If indeed they're working, we want to make sure the safety of our staff, because if there's something on their eyes, it should be, available at all times. So those are the things that we're checking every day. Like I said, Marie Resurrection is the microbe police. She come just unannounced and just
Microbe
say,
police.
yes,
What
that's
a
the
title.
way it is. But, according to her, it's my pride and joy to say that she always say, this is heaven to me, this
Oh,
place.
really?
Yes.
That must
yes.
be just the cleanest office in the whole building.
That's what she's saying all the time.
Yeah.
Over and over. Even we have a visitor from Off Island. She will just say it before she even come. Oh, you should see CSSD.
Really?
She said,
That's
so-
not a have you been in there, Charlie?
I've been only to the front area.
Oh, okay, but you can't go into the inner
I
sanctum.
want to invite you one day. If you're
I
not
will
busy.
scrub everything.
Yes, and then
I will make
you
sure.
will see it the way the way
I'll
it
come
looks.
in with no germs. I
Yes.
promise if you let me just look around.
You can come and announce
Okay.
with Charlie.
Oh yeah.
anytime. I
Well,
will-
see, we're planning this. We're planning as soon as we go through all of the departments, right? I think, or the majority of them. I'm going to actually go and take the
Yes.
real intense tour because then
Yes.
I've met pretty much everybody and I
course.
can see all the functions
Yeah.
of GRMC and know what now to match the departments with the people and the
Yes.
and the topic.
It is a visible testament,
Yeah.
what I'm talking about is not just because I want to sugarcoat because it's my department. No, you need to come and see
Okay.
it. You're welcome anytime.
Thank you. But the standards are there. The standards
Standards
must
are
be
there.
above. Yeah, you have to
Yes.
comply with the standards.
Yes.
But it sounds like you go above and beyond.
Yes.
I appreciate meeting you. Thank you so much,
Of
Amy. It was so
course.
nice to meet you.
Yeah.
It's also nice to meet you as well.
Same
You
here.
guys, Merry Christmas to you, and I hope to see you sometime soon up there at GRMC.
Of course, I expect you to be
Oh.
there. And don't forget, just please, shout out for those
Oh, yeah.
Oh, yeah.
I just
companions.
want,
She
just
said
want to
shout out, so
shout
you better
out
go
for all
shout
the
out there.
CSSD technicians. They said they will be listening
Oh,
to
cool.
us.
Okay.
So while we're doing this interview,
Shout out to the Central Sterile Supply Department. You want to name them?
Yeah.
Who's there?
We have Nate, we have Jose,
Uh-huh.
I have Oliver,
Oliver,
and I
Anthony,
have Anthony
and-
and Jonathan.
Oh, all
Yeah.
males.
Yeah,
Lucky
all
girl,
males.
Amy.
Yeah.
Now
Yes,
I
yes.
see how you staffed
Yeah.
them. Way to
But
go.
I put them in place,
I
all
bet
the
you
time,
do. You're
so-
putting me in place, and I don't even work for you. I appreciate it. Thank you so
Thank you,
much for
thank you.
coming. That is, I'm Amy Egurrola. She's a CCD manager in Alcie Papa. He's a CCD, a CSSD.
Yes.
Sorry, CCD is a whole other thing. That's the Catholic Church. CSSD, a technician. And